Hello YouTube and YouTube subscribers. How are you doing today? Let's all say in unison, I'm doing the best I can. Okay, that's good. So today I want to talk about anxiety and cardiology at the same time. So specifically about heart monitors, and more specifically about a Holter monitor, and also the process of which you would be prescribed a monitor. So first off, I'd like to say to all the anxiety sufferers out there that experience panic attacks and terrible sensations with adrenaline and heart symptoms and sensations, that it is really important, if you have not already been evaluated by the proper physician. So for example, if you were out in the pool and your heart was beating really fast and you had anxiety symptoms that wouldn't subside, that really took you to a whole new level and needed to be hospitalized, you are just going to the emergency room and you are going to get a 30-second read for a ECG, and depending on the severity of what you're having, you might end up with a constant, continual ECG hooked up to you. But you're not amongst specialists. So you're in the emergency room with emergency doctors that are trained to basically get you in and out and refer you. So you don't want to get to the point where you're just going in and out of the emergency room without being properly diagnosed by a specialist. So I'm not saying that the doctors in the emergency room don't know what they're doing. I'm just saying that they're not trained or boarded to the utmost expertise that is parallel with an electrophysiologist or a cardiologist or interventional cardiologist and so forth. So be mindful about how your life has processed so far and what you've actually been diagnosed as, or what they think that your diagnosis is. So it's important to be specific with your diagnosis there so that you can have the proper treatment. So without the proper treatment, you're going to keep on having the same symptoms without any kind of alleviation, which is basically hell that I've gone through, thinking that all of my symptoms were the result of anxiety and panic, whereas I actually have both. I've had heart conditions and anxiety that contribute to my terrible sensations on a daily basis. So anyways, if you're just going to a general practitioner or your primary care for this, that's not going to be enough. Hopefully that, if your symptoms are prevalent enough, that they would refer you to a cardiologist, and then the general cardiologist would give you workups like a stress test, which is when you go on the treadmill and then they hook you up to a monitor to see how your heart deals with exertion, and you're going to have an echocardiogram, which is when you lie down and you can see like the ultrasound of your heart, and then they have like a little wand, and it's the same thing as like if you were to have any ultrasound on an internal organ, but it's your heart. So they want to make sure that you're structurally normal to rule out any structural problems that would be causing your symptoms. And there's a few more tests that they do if they feel like it, or if it warrants extra testing, but those are the general tests that you'll get. And it's really, really helpful to have a doctor tell you, oh, you know, your results came in for your echocardiogram, you know, you are structurally normal, meaning that your heart is structurally normal like a bridge would be with no missing trellises. So then that means that something else is wrong with the bridge, or could be wrong with the bridge. So something else could be wrong with your heart, which leaves the electrical system of the heart or any other physiological underlying conditions. So then what happens to you then? You're like, okay, so I've seen this specialist, I've seen a general cardiologist, I've had my testing, I passed the stress test, you know, I did this and I did that, so why am I still getting these sensations? Why am I still getting these feelings of skip beats? Why is my heart beating so fast all the time when I'm not nervous, etc.? So the next doctor that you'll be referred to, if not at the same time, is an electrophysiologist. So the electrophysiologist is a cardiologist who has specialized in electrophysiology. And that is the electrical system of your heart. So yes, your heart has an electrical system. It's very complicated, but not so much to a specialist. But even then, so there are certain things that are unknown because our bodies are just incredibly complex, especially the brain. And having an electric system in your heart, I mean, think about it. These doctors have a lot of research to do to help you. And they have dedicated their whole lives to help you find out what the cause of your uncomfortable symptoms are. So, having said all of that, number one, don't just rely on a primary physician to diagnose you with something that a specialist should be left to diagnose you with. I mean, you really need a specialist. Your heart is a very special thing, obviously, so you don't want a generalization of what could be wrong or what they think is wrong, which will only end up in treatment that they think is right or they think is going to work. So you want to be dead on about what your condition is and what can be done about it to improve your quality of life and your overall physical self and mental self. So let's talk a little bit about this heart monitor business. So this is something that you'll definitely have prescribed to you by your electrophysiologist and or your cardiologist, is a Holter monitor. So if you've never heard of that, you're probably thinking of like a horse or something, because it's like, or a gun, it's like a Holter. But the Holter monitor is a device that, you know, you can have a wireless one, or you can have one with all the leads and the suction cups and the little electrodes all over your chest with a handheld device, or you can have one like I have on, which I don't know if you even noticed that I had. So let's talk about that first. I'm gonna drink some water real fast because I'm in need of water. It's always good to keep hydrated when you have a heart condition, and even when you don't have a heart condition. Water is like totally essential, so don't forget to hydrate yourself because that'll eliminate a lot of unwanted symptoms. So this is what I'm going to talk about today. This is a heart monitor, which is called a Holter monitor, but this one's wireless. So this is the Zeo XT. And then it even has return postage on the back, which is awesome because a lot of anxiety patients like myself don't like to drive. So you can just put it in the mailbox and then they pick it up, which is amazing. So this is one of the newest ones that's out on the market right now. I believe that 80 to 80% of insurance covers this, but it's unfortunate if your insurance does not cover this because this is such a wonderful opportunity to wear since it's wireless. I'm so used to walking around with one that has wires poking out everywhere, and it's really annoying and people look at you like something's wrong with you. So it's nice to have this. So this is what it looks like. So if I'm having an event, all I have to do is press this and then you'll hear it go up and down. There's no beep, it's just a click. These are the electrodes and my heart is underneath it because it's on the left-hand side. And what it does that's different from the other monitors that are kind of older and archaic is that all the information that is being read from my heart is being stored in this unit, as opposed to having one that goes to the handheld monitor device and you have all these wires connected to you, and you know, sometimes you'll have a device that the data goes directly to the hospital and they have to monitor that, and when something abnormal happens they call you, and it's just more convenient to have this. So in any event, sorry about the pun, but this is an amazing product. I mean, no one would even know if you had it if you covered it up. But anyways, so what is this doing? This is prescribed to me to make sure that my heart is in the condition of which they think it is. Can it detect like a heart attack? It can indicate a heart attack, but really when you're having chest pain and all that other stuff that you feel during a panic attack, the hospital can detect a heart attack with the protein extraction of troponin, and it's very easy for that to happen. So, but anyways, we're not talking about heart attacks today, which is a myocardial infarction, which is MI for short. So we're just talking about Holter monitors and anxiety and panic. So I'm sorry, I kind of drifted off that way. It's not very good to talk about heart attacks with anxiety patients such as myself. So what makes this different than other devices that I have in my purse? So as you know, my pulse ox can tell how many beats per minute my heart is going, and also the oxygen saturation. So right now, I'm probably not too tachycardic because I took my medicine and I took a lot of it today. So my oxygen is at 99. And then my heart rate is at, I don't know, I can't really see it, 89, but it'll climb, of course, because, oh no, now it's at 91. But that's normal because an adult heart rate should be roughly between 65 and 100. And anything beyond 100 would be tachycardia or tachycardic. So this device cannot and won't and can't detect your heart rhythm. Just because some of them have like the ECG printouts on them to make it look like, you know, you're getting a reading. It's just a fancy extra that they put on there to make it look like it's doing more than it is. So that's not the same as a heart monitor. This is a single lead, and so is this. So this is my EMAY. It's EMAY, and I bought it on Amazon for like $120. And it's awesome. So if I want to record my heart rate, I put my fingers on both sides of the paddles. And then I will record myself if I feel something's wrong. So what is the problem with this? The problem with this is that it's not going to record anything that you're not aware of, which means that you have a less likely chance of recording something significant. So let's wait and see what it says. My heart rate's really low for me right now. So this is what I want to see. I want to see no abnormalities, and that makes me feel so good. But most of the time, that's not the case. This will tell you, like, if you have atrial fibrillation, it'll say possible AFib. It can't diagnose you, but it can tell you what it thinks you have. So this is a single lead, and this is a single lead, but the difference is that this is only at your fingertips when you want it to be. It's a convenient, at the moment, read and possible diagnosis that you can Bluetooth to your phone, and you can actually email the readouts to your cardiologist. Or you can learn how to read them yourself, or you can read them yourself if you're in the medical field. So this is different because this is a constant read. All day, all night, it's a constant read. So all the information right now is being stored in this, as all the information can only be stored in this per activation. So this can't help me if I don't use it. This is helping me regardless if I know I'm having an event or not. So what's it like to wear one? What they do first is they take sandpaper, like legitimate sandpaper, and they score your skin for like a minute and make sure that it's free of all oils and creams or any body fluids or whatever you have on yourself. God only knows. So, and then after that, they take a wonderful alcohol pad after they just scoured the heck out of your skin, and it burns and it hurts like hell. And you're like, oh, well, you have all those tattoos. Well, what is she talking about? Well, there's a different kind of pain there. So then they place this on here, and after the alcohol is dry, that ensures that this adhesive is going to stay and not peel off. So how long do I have to keep this on? The maximum for this one, I believe, is 14 days. So sometimes people get 24-hour Holter monitors or 48-hour Holter monitors. This one's a good one because it's more of a lengthy time. And a little tip for you, if you ever get your monitor prescribed to you, make sure you aggravate yourself. Like, go up and down those stairs, exercise, eat the foods that make you aggravated, because if you don't, you're going to yield no abnormal results, and then they're going to think, okay, this person is seriously just an anxiety / panic attack patient, and there's no need to further this cardiology regular appointment schedule for this person. It's just a waste of our time. So you want to make sure that if you're seeking treatment for something that's bothering you, you have to aggravate your heart in order for them to see the results of how your heart reacts to the exertion or the foods or the situations in which you are, so that they can see evidence. So if there's no evidence of a problem, then you're not going to be able to get that medication that you need, and they're not going to continue care with you, and they're just going to give you a follow-up. So if you're really concerned about your heart, make sure when you have your monitor on that you provoke your heart to have those uncomfortable symptoms, which is very unpleasant, but it's necessary. So here is my little log that I have. It's a diary of when I press this button, they want to know why I pressed that button, what sensations I'm feeling. So let's see what the example is. Okay, here's the sample. So it says, I pressed the button on this date and at this time. And then I pressed it because I felt, this person said, dizziness, lightheadedness, or vertigo, fluttering or racing, or other. Mine's always other because it's always like adrenaline surge, you know? And my heart yesterday was terrible. Like, it was just, all I did was eat something again, and it's like my heart flew up to like 148 beats a minute. It almost went bonkers just because I ate like a little snack. So hopefully this time around with this new device, they'll be able to find out what it is that is troubling my rhythm. So my rhythm is sinus tachycardia, and I have inappropriate sinus tachycardia, meaning that my heart just blows out of the water and makes me feel like I just ran a marathon and a triathlon. I swam across the Pacific Ocean just by sitting down on a recliner. So I need answers. So hopefully the Zio XT does that for me, which is supposed to be a lot more accurate than the older monitors that they have. So anyways, that concludes this video talking about the heart monitor and what it does. I mean, it determines what your irregular rhythms are, and it just helps you guide your doctor to the correct way to treat your heart and your symptoms. So doing this and listening to your doctor and saying yes to wearing a Holter monitor can make all the difference in your diagnoses and making sure that you are getting the appropriate treatments, meaning pharmaceuticals or relaxation techniques, or both. So in my case, I would need both because I have a heart condition that induces my anxiety, which then causes panic attacks, and then it's just a vicious cycle. So, however, my situation is different because I'm getting progressively worse. I'm not getting better. So when I was 8 years old, I started manifesting these symptoms, and they thought it was just panic because my general physicians just blew it off and said, yeah, she's been through a divorce with her parents, and you know, this is typical. And then they refuse to refer you out because they're just like, oh, well, it's just anxiety. Well, that's not the case so much anymore because of the new technology that we have, such as the Holter monitors, and also, you know, the state-of-the-art blood testing and, you know, analysis that the hospitals and the doctors have access to nowadays. So everything is changing. So, however, please get yourself evaluated correctly, appropriately, and in the right department. Again, your general physician is not trained to give you a detailed, specific, specialized diagnosis of your heart. Only your cardiologist, your interventional cardiologist, and your electrophysiologist can do that. So I hope that that helped you determine which way to go with your treatment and what to expect in the hospital, what to expect with being referred to different doctors, and what it's like to wear a Holter monitor. So I hope that gives you a peace of mind and gives you some idea of what to do next. Have a great day.